So hospitals across the state are desperately working to keep up with the surge in COVID cases, but there's another battle happening every step of the way.
As Mike McDaniel explains, whether it's the vaccines or masks, misinformation is not helping medical experts.
Medical workers are fighting COVID on two fronts these days, one inside the hospital, the other on the outside.
Misinformation spreads at 6 times the rate that actual information spreads at.
Dr. MarkAlain Dery, Director of Infectious Diseases at Access Health Louisiana, says misinformation, specifically when it comes to masks and vaccines, unfortunately rules the day.
I've never seen misinformation to the degree that we're seeing it today.
Oftentimes people don't realize that they have been exposed to misinformation.
Region 1 Health Director Dr. Shantel Hebert-Magee says it often starts with a hint of truth, helping it spread, much like a virus.
Then it takes a very distorted, deleterious turn that causes people to then question the scientific data.
Questioning the science was on display by some elected leaders at the state capitol Monday.
Why do we continually push things that people don't want to do?
Because it's going to be the thing that helps us slow down and stop the spread of Delta.
Medical leaders were testifying before the House Health and Welfare Committee and were interrupted at times by audience members. Testimony from the state's medical director, Dr. Joseph Cantor, had to be delayed because some people didn't want to wear masks. Later, Dr. Cantor called out public figures on Twitter who peddle conspiracy theories to do better, saying families are being caught in the web of misinformation and are suffering greatly.
When these elected officials say and repeat these conspiracy theories or this misinformation, the downstream effect are me and my colleagues.
Dr. Dery says the healthcare system can't take that burden. He and Dr. Hebert-Magee point to credible sources like the CDC as places to get information from. Because information is steadily coming in, Dr. Hebert-Magee says it may change, but turning it into misinformation is dangerous.
This is not an experiment, but this is an experience, and we are all a part of this experience, which is the pandemic.
Mike McDaniel, Eyewitness News.